To talk about the situation on the ground in Rafah, Jason Nickerson is the Humanitarian Representative to Canada for Doctors Without Borders, or MSF. He joins me in studio. Jason, to start, what have you heard from your colleagues in Rafah?
Well, first of all, our colleagues are absolutely terrified. I mean, the majority of our staff are Palestinians themselves. They're making impossible choices every day of meeting the needs of their families, being forcibly displaced while also continuing to provide medical care under an absolutely impossible set of circumstances. You know, obviously the incident, the airstrikes that occurred over the last couple of days, we have medical operations that are very close by. We received a large number of wounded patients, 180 wounded patients and 31 dead within minutes of the airstrike on Sunday. And, you know, as I say, this is an impossible set of circumstances. We're providing medical care, but within a health system that's effectively destroyed.
I mean, many people will have seen some very disturbing images from this weekend, but when you are able to communicate with your colleagues or get reports from them, I mean, what were they able to tell you about how you manage in a situation like the one that you just described, with this incredible influx of injured people desperately in need of care?
Sure. So our organization, Doctors Without Borders, or Médecins, Frontières, we were operating at what's called a trauma stabilization point. So this is exactly that. It's a point where wounded patients are able to come. We triage them into red, yellow, and green, depending on the severity of injuries. We stabilize them, and then we refer them on for additional care. So look, the honest reality here is that there is no hospital or health structure in Gaza today that's capable of receiving 180 wounded patients and providing, you know, mass casualty response at the scale that is needed. The health system has been effectively dismantled. And so what we're hearing from our colleagues is that the patients that arrived had extremely severe injuries, burns, fractures, shrapnel wounds, and need medical care that's frankly not available in Gaza today.
MSF has said that some of the people working in that facility had to flee. Is the trauma stabilization point still operational right now?
As of today, it's not. We had to close last night. Fighting has escalated in the last day or so, and as a result of the increased fighting, our staff had to leave, and so that trauma stabilization point closed as of today.
So what happens now in terms of the work that your group is doing? Do you wait for conditions to improve? Are they trying to offer, I guess, ad hoc help where they can?
So we are working in a number of different clinics and hospitals in Gaza. So we have staff on the ground who are doing the very best that they can. But you know, the reality is that the conditions do not exist to be able to provide the level of healthcare that is needed at the scale at which it is required. That is precisely why, since October, we have been calling for a ceasefire in this conflict, not as a political statement or a political act, but simply because that is what we believe, as an organization that works in conflicts around the world, is necessary to be able to allow for an effective humanitarian response at scale, to bring in the humanitarian supplies that people need and to allow people to access things like basic health services. We need a ceasefire absolutely immediately.
When we look at the global response to the deaths over the weekend at the camp, there has been outcry. Many countries, including Canada, are pushing for a ceasefire, and yet we do see further incursions into Rafah. Today, Israel continues to say that its measures are targeted, that they are focused on trying to root out Hamas. What hope really is there for a ceasefire at this moment, given the reality that we have seen play out in the last week or so?
Well, I mean, I'll say that, look, when you have fighting like this in a densely populated area, I mean, we're talking about Rafah that now has, you know, more than 1 million people who are in an extremely densely populated area. When there are bombs that are dropping and fighting that's happening in close proximity, I mean, there's going to be mass casualty incidents like this, and that's absolutely outrageous and unacceptable. And so, I mean, this is precisely why we and so many others are calling for a ceasefire, so that people have a reprieve from this fighting. And we're talking about, you know, children, women and children who are arriving at our health facilities with severe burns. Many of these people were living in a camp for displaced persons. They were sleeping in tents. These are flimsy shelters that, as we've heard, were engulfed in flames, and that led to severe burns with, people with burned plastic and other horrific kinds of injuries. So this absolutely needs to stop. But also, I will say that the International Court of Justice has twice come out and said that there must be unimpeded humanitarian access and humanitarian supplies coming into Gaza, and that is also not happening at the scale that is required. So there are multiple things that need to happen, including ceasefire, humanitarian assistance coming in at a much larger volume, because the situation is absolutely desperate, and right now nowhere is safe in Gaza.
If we look at the camp incident in particular that has focused additional international attention, the IDF did say that it believes that it was not the bombs that it was using alone that would have caused this level of death, that there was perhaps, one of the possibilities they're exploring is that there was perhaps a weapons cache nearby, which led to this, that it will be investigating to get to the source of this. Does MSF, Doctors Without Borders, support that kind of investigation?
Well, there needs to be investigations and accountability for these attacks. Absolutely. I mean, at the end of the day, I'm going to come back to what I said previously. I mean, this is fighting that is taking place in an extremely densely populated area. I mean, this is simply wildly inappropriate, and that is precisely why we are seeing such high numbers of casualties. We're seeing that in our hospitals, women and children arriving with severe injuries and needing medical care that's simply not available in Gaza today.
So how do you, at this moment, plan for the future with the situation that you're describing, the suffering on the ground, the political reality of what is playing out? What does your organization do as it does try to provide medical support for people?
So as I say, we still have teams that are working on the ground. I mean, we have supplies that are ready to come in. We are ready to scale up. We are ready to provide a response. But today, the conditions simply don't allow for that to happen. There's two elements that I think we need to keep in mind here. One is that, first of all, there needs to be an unimpeded flow of humanitarian assistance into Gaza, so border crossings need to reopen. Rafah has been closed since May 7th, and so, there are trucks literally sitting on the border with life-saving humanitarian assistance ready to come in. That needs to happen immediately. But it's not just about bringing supplies into the country, it's also about having assurances of safety and the means to actually distribute it throughout Gaza. Right now we're seeing, some aid coming in through the north. It is still inadequate, but it's not reaching the south. The south is now closed. We can't bring the supplies in to then reach the hospitals and reach people who need it. So it's a logistics problem, but it's also fundamentally a political problem.
And is there more that the Canadian government could be doing then to try to put pressure, in your mind, on some of the issues that you've raised?
Well, all countries need to be using whatever diplomatic tools, leverage, power that they have. It's obviously positive to see Canada coming out and calling for a ceasefire for the reasons that I say. This is what's needed to mount an effective humanitarian response. But we need all countries, including Canada, to continue to push for humanitarian action and for the protection of civilians and the protection of humanitarians inside of Gaza.
Okay, thank you very much for this conversation. Jason Nickerson is Humanitarian Representative to Canada for Doctors Without Borders.